I wanted to make this video to kind of rant and just vent about my experience with the healthcare system and health insurance in general. I know I talked about it for a bit in one of my previous videos, but just kind of wanted to go over everything that's been going on with me over the last few months. So, back last year, I had to switch insurance to an HMO, a marketplace insurance, because I switched jobs. And when I made the decision to go on this insurance, it sounded like it would be a good plan. I did not intend to use it to be seeing a dermatologist, though. My skin at the time was manageable. It wasn't the greatest, but it was manageable. It wasn't affecting my day-to-day life like it is now. So this was back in probably August or September that I made the switch over. And I was like, whatever, I'll just pay for it for a few months until my new job's insurance kicks in. So unfortunately, only after a few months of being at that job, I was laid off because they just apparently did not need me, and it wasn't working out according to them. So I got laid off, and this was just before I was about to go on to this new job's insurance plan. So I had to end up keeping my HMO plan. And so I had to pay this out-of-pocket premium, whatever. That is much more than if you had insurance through your job. So anyway, I am keeping this insurance, and about January, February, I go and see a dermatologist because my skin is, at this point, getting pretty bad. I go and see a dermatologist. They do another biopsy on my skin, and they say, yep, you have psoriasis, even though the year prior I had 2 biopsies on my skin in 2 different spots. They said I had eczema. This time around, they're like, nope, you definitely have psoriasis. So, yeah, a big thank you to the other fucking dermatologists that got my biopsy wrong, because now the treatment, I guess, changes and all of that. And it's pretty fucking incredible that they could fuck up 2 biopsies like that. It's just crazy to me. But anyway, they tell me I have psoriasis, and they want me to go on to do UV phototherapy, which is actually what I wanted to do in the first place. And the dermatologist that I was working with at the time, he was mentioning a biologic medication, which is also something that I would actually want. But I did want to try the UV phototherapy first. So we proceed with that plan of doing the UV light therapy. And I go ahead and start it. And I noticed after doing it, I would be a little itchy and stuff after it, but it didn't bother me a whole lot. I ended up doing 11 total sessions of UV phototherapy, and then I started having a reaction. Actually, before this, I will add, when I went in for my first ever UV phototherapy session, the nurse that I worked with said that I was going to be put in that fucking booth for a minute and a half. A minute and a half. I was only supposed to be in there for 27 seconds. I thank Christ that I corrected her, because I was like, wait, that does not sound right. So she actually had to double check, and she was like, oh yeah, that's my mistake. Yeah, it's going to be 27 seconds. They were going to fucking cook my ass in that fucking booth for a minute and a half. I can't even imagine the amount of agony I would have been in, or that my skin would have gone through, if I would have been in there for that long, because I didn't even hit a minute and a half total for my sessions. I think I ended up being in there for like 49 seconds at most or something towards the end. And I ended up having bad reactions. I ended up having polymorphous light eruption, which is sort of like a light reaction, a reaction to sunlight, apparently. And so I was breaking out in this rash. My psoriasis-affected skin would feel like it was burning, and it just wasn't going well. And I'm like, I have to stop this. Like, this is not working out. And I wanted to move on to an alternative. So during this time, unfortunately, the dermatologist that I was working with left the clinic. There were only 3 total dermatologists there, 2 full-time and 1 part-time. He was one of the full-time dermatologists. So he left, which leaves 1.5 dermatologists there, basically. And I fought and fought and fought to get another appointment with one of the other derms, and I got put on a urgent wait list, which wasn't too urgent because they never called me back. They never told me that there was an appointment open. I kept calling and calling. Nope, we don't have any openings. We don't have any openings. I went to urgent care and had a couple regular appointments with my primary care doctor about my skin. And every single time, I think 3 or 4 doctors took pictures of my skin. And every single time this went to dermatology, they're like, nope, you can wait until October for your appointment. That was my original next booking for a dermatologist, was fucking October. From February to October, being forced to wait 8 months, which is absolutely absurd given the severity of my skin. So I fought and fought and fought. I asked if I could be seen outside of my clinic to go through another provider, and if the insurance would cover it, because I was told that there was a chance that they would. And of course, I was denied because the reasoning was, well, your current clinic offers the services, so you do not need to be seen outside of your clinic for the services. Simple as that. They don't take in the severity of my condition. They just don't give a fuck about it. So I appeal the decision. I actually ended up I participated in a board meeting with doctors from the clinic and from outside of the clinic. And the moderator told me after after I pled my case to the doctors, that the decision would be made, this was on a Tuesday, the decision would be made on Friday. A half hour after I participated in that meeting, I got a call, or I got a letter in my MyChart saying that the decision to cover any sort of outside visits for dermatology were denied. Again, the reasoning is my current clinic offers the services, you can wait. Truly fucking mind-boggling. And then I get another letter saying you have exhausted all appeals, you are being forced to wait. The most ridiculous shit I have ever seen. And I, again, kept messaging, I kept going to doctors and all that. I did get lucky and have my appointment pushed up to July, so it saved me a couple months there. But yeah, that was quite the experience there with the fucking insurance and all that. They refused to have me see anyone outside of my clinic just because, we offer the services, so therefore you can be seen by us, regardless of the wait. And then I was told by one of the medical directors that it actually doesn't matter where you go, because the average wait time for someone to be seen in dermatology is a year. I don't know what the fuck the issue is. I live in Wisconsin. Apparently, everyone in fucking Wisconsin, every single goddamn person in the state, has a fucking skin condition. I don't understand how there can be that much of a wait to be seen for skin issues. It truly boggles my mind. I don't know. Maybe I'm just kind of overthinking it. I don't know. It just doesn't make any sense. I never would have thought that there would be that long of a wait everywhere you go, no matter what clinic you go to, that there'd be that much of a wait to be seen by dermatology. It is unfucking believable. And I know one of the clinics, I even looked into it, they had 30 dermatologists on staff. 30 on staff. And I was told that the booking was a year out by their staff. I called the clinic. The lady who schedules was like, yep, they're booked out a year. 30 fucking dermatologists, and I can't be seen until a year from the time I called. That is fucking insane. And yeah, my insurance only covers my clinic. My insurance is actually my clinic. They have the same name, and I'm not going to go into names and all that bullshit. But yeah, it just truly incredible that I could not be seen no matter how much I fought to be seen, given the severity of my condition. And all of the pictures that they took of my skin to be sent over to dermatology. And then dermatology just sits there and says, no, you can wait. You can wait till October. It doesn't matter that most of your body is covered in fucking uncomfortable fucking rash. No, you're fine. You can wait. It's unbelievable. I never ever had such a fucking hassle with the healthcare system. I will say that the healthcare system in general overall is just fucked. It is truly, truly fucked. So, like, even if I go in for just a general, like, visit or something, and I have concerns because I have bad anxiety, if I have a concern about something, I want to, kind of speak in depth with a doctor about it, what I can do and all that. But no, you don't get to do that. You get a nice long 15 fucking minutes with your provider to go over all of your issues, to go over everything you're dealing with, just to have them write some bullshit prescription or give you a bunch of nonsense on what you can do that doesn't actually help, because you can't actually ask all the questions that you want or relay all of the information that you need to in order for it to be beneficial for both of you, for both you and the doctor to know exactly what's going on. You get 15 minutes and that's about it. And then if you're lucky, you can book another appointment maybe a month or two out with the same doctor for another 15 minutes to continue the conversation, because it's that fucked up. So yeah, I've also had that experience as well. Very dismissive doctors. They view me as an annoyance, apparently. It seems like every single... And this isn't just my current clinic. This has been over the past couple years. I've gone to 3 different clinics, and the primary care providers that I've had there are just all fucking assholes. Everyone in urgent care that I've seen there are just fucking assholes. They absolutely are miserable, hate their life. Just truly, it's just so fucked. Like, I've had to actually file complaints against a couple of them because of how unbelievably rude they were. And I can usually tolerate someone being a little snippy, whatever. If they're having a bad day, I totally understand it. But the entire visit of seeing someone was just them being a total condescending fucking asshole. And I'm like, no, I'm not gonna tolerate this. I'm not gonna take it. No fucking way. Of course, you file a complaint, nothing's going to happen. They're a fucking doctor. You really think they're going to get fired or reprimanded? I highly, highly doubt it. I'm sure nothing fucking happens to those people. They can walk all over everyone. It doesn't matter. They can treat everyone how they want to treat them. They don't give a shit. Nothing's going to happen to them. But just such a shitty experience overall everywhere I've gone. And I've had quite a few different things happen over the last couple years, and it's so sad to see the healthcare system be so fucked. You have such rude staff and just incompetent people. You don't get to actually have time with your provider when you actually get to see them for once. It's unbelievable. I don't know if that's how it is other places. I just know that's my experience here in Wisconsin. It has been really just harsh. It's been fucking awful. It's been truly miserable. And I dread going to the doctor for anything nowadays, because it's like, I already know it's going to be it's going to be a fucking dog shit experience. So yeah, there's that. But going back to the dermatology side of things, same thing kind of happened to me there with my visit. I had my actual dermatology appointment last month. I was really looking forward to it. And of course, can't get the actual medication that I need for my condition. So unfortunately, insurance, of course, determines the patient's well-being, not the doctor. Because, of course, they have a fucking step program that you have to do in order to get on the really nice medications that actually fucking help you. So for my condition, the steps are usually a topical steroid or ointment or whatever that never helps anyway. No one usually has success with that shit. And given the amount of body coverage that I have of my psoriasis, unless I want to use a whole tube of fucking steroids all in one sitting, that's not going to be very feasible. So can't do that. And I've tried them in the past. They didn't work. They didn't do shit. They didn't help. And this was when I wasn't nearly as bad. So then they had the phototherapy, tried that, fucking failed, because apparently my skin doesn't like UV light. It breaks out in a rash and fucking gets angry and shit. My immune system's just so fucked. So we do that, and then he's like, well, you're probably going to have to do UV phototherapy again, because we don't have official medical documentation that you had a reaction to this. So yeah, you're probably going to have to do it again, which absolutely floored me. I was like, so I literally reported a reaction to 2 different people who work here. I said that I was having a reaction. The previous dermatologist that was here, I told him I had a reaction to it. And you're still telling me that, oh, because there wasn't someone like basically looking at my butt-ass naked body, seeing me have a fucking reaction to this shit, that, oh, it doesn't count, so you're going to have to continue doing the light therapy anyway. Just unfucking believable. So, yeah, I'll probably have to eventually go through all that fucking bullshit again. So yeah, was told I'm going to have to do light therapy even though I 100% failed it, and there's a reason I stopped it. Otherwise, I would have gladly continued it. That would have been just fine. But no, of course not. So, there's that, and then he told me, well, you either have to take acitretin, and it's definitely acitretin, or methotrexate. Both drugs are supposedly the gold standard for like rheumatoid arthritis and shit like that. At least methotrexate is. And I know it can be helpful for psoriasis. Apparently, only 30% of people do well on the medication alone. Why the fuck would that be prescribed if the efficacy of it is so shit? I don't get that. I could be totally wrong. That's just what I've seen. I don't understand how you can prescribe that to me when it's not even meant for psoriasis. It's technically a chemo drug, but at low doses, it can be used for rheumatoid arthritis, and it can be used for psoriasis, but it's mainly used for rheumatoid arthritis. It's not even fucking made for psoriasis, which is it's just unreal. So they prescribed that to me, and the majority of people that take that shit basically have the worst fucking side effects that you can imagine. Their hair falls out, they get nauseous, vomiting, feel like dog shit, just like totally lethargic, kidney issues, liver issues. Their blood work is totally out of whack. But no, this is the gold standard treatment for this apparently, and it's just terrific for psoriasis. This will definitely help. This will make you feel better. And just learning that, I was just like, I can't do it. I can't fucking take this medication. And I told him, like, I would prefer a biologic medication, because everything that I've seen on those is that they are much more effective. They take effect quicker. And there's a lot less bullshit with it. There's a lot less side effects with them. They just overall seem better. And they also target specific areas of your immune system versus with methotrexate. Methotrexate, it doesn't wipe your immune system, but it affects your entire immune system. And I would prefer to, be able to have a functioning immune system for the most part, or at least more so of a functioning immune system, on the biologic medication versus the fucking methotrexate. And anywhere you go, you can go on fucking Reddit, you can go on medical websites, anything. You will see that methotrexate just is known, it's notoriously known for having shit-ass side effects. Like up to 65 to 70% of people, side effects. Just, who the fuck wants to deal with that? I know I'm not going to, and you have to take it weekly. So you take it one day of the week, and then that following day, so if you take it on a Monday, you're going to take it the next Monday, and then the next Monday. And they want to up my dose and shit as we go along. But even on low doses, people experience a fuck ton of side effects from this shit, and I'm just not about it. I have a sensitive-ass stomach as it is. God forbid I get fucking nauseous and start vomiting because I have a huge phobia of throwing up. I absolutely cannot fathom the idea of having that happen. I hate nausea as it is. I get super fucking fearful when I get nauseous. It is a total shit show when that happens. I start freaking the fuck out. I just can't take it. I can't take being nauseous. It's one of the worst feelings in the world. So yeah, just knowing this, I'm like, I can't take this shit. I need a biologic medication. He's like, well, we can't do that because you have to fail this before we can move on to something else via insurance. So literally, insurance is determining my well-being and keeping me from getting the drug that I should be ideally getting in the first place. Again, given my severity of my condition, it's crazy. It is fucking crazy that you literally have a medication or multiple medications, there's multiple biologics, that would be just fine for me. That'd be just fine and effective. They'd probably work fine. But no, you are forced to take the fucking poison that they want to give you first, because insurance just simply doesn't want to fork out the money to pay for the more effective medication. Go figure, right? You pay you pay however much money. I mean, right now I pay, I think, $160 a month for health insurance. There are people out there that pay, they pay their premiums and shit. You pay the health insurance company this money for them to provide a service to you. They do everything in their power not to provide that service to you. They do everything in their power to not pay the money that they should for the medication. They would much rather save a fucking dollar at your expense than just, fork out the money or help pay for the medication that you truly need to help you out and, get you back to normal. That's all I want, but no. Insurance determines that, and it is fucking sad. Health insurance and the healthcare system is fucked. It really is fucked. And it has been fucked for a long time. And I'm just now finding out the hard way, unfortunately. So yeah. And during the visit with my dermatologist, my mom was actually with me. And we were both asking questions. We were trying to ask as many questions as we had about like the condition, the medication, all of that. Of course, the visit is only 15 minutes. So one of the nurses actually knocked on the door to signal, hey, it's time to go. And the doctor literally was like, we have exhausted our time. I have to go. Mid-question. We were literally in the process of asking one of our final questions. He bolted out the fucking door. That's it. He wrote the prescription for the methotrexate and didn't even provide the pharmacy that's right downstairs from the clinic. Didn't even provide them the dosage or anything. Just wrote a fucking script. Methotrexate, no dosage, no nothing. And folic acid or whatever. He actually did put the dosage for that. No dosage on the methotrexate. Just put fucking methotrexate. And the pharmacy's like, yeah, we need to contact him because he didn't put a dosage in there and all that shit. So I had to transfer the med to another pharmacy. Just a total fucking shit show. And this is how it's been for the last 6-7 months. It's just been an absolute shit. It's just been fucked. Like, I know I'm all over the place here with talking about this, and I know this is a lengthy video, and I apologize, but I just have to bitch and rant about it. It's truly fucking insane that I am just being forced to suffer with this condition when there's literally something out there that can be given to me, and I'd probably do fine and improve. But I just can't bring myself to take this fucking medication. Like, I'm sorry. I mean, I may be a pussy, but I can't. When the majority of people on methotrexate have a fuck ton of side effects and literally have to discontinue the medication anyway, what is the point of doing it? It's absolutely just pointless to me when they can just give me something that's much more effective and be done. And it'd be a quicker time of me improving as well. But no, insurance determines that. Insurance determines your well-being. Just I cannot believe that this is where we're at with healthcare system. It's so fucking stupid. And of course the dermatologist is like, well, I guess I could write a prescription for one of these biologics, but insurance isn't going to cover it. And at this point, I'm just like, just fucking write it. I'm going to try and look at getting onto a bridge program for one of these, depending on what biologic I can get on, if I can actually get on one, if the doctor will actually prescribe it for me. Holy fuck. I am so sorry for this massive rant, and I'm talking a million miles an hour. Jesus Christ. I usually don't talk like this, or at least I've never noticed myself talk this fast. But yeah, this is where I'm at. I'm just trying to make sure that I get all the details out, because who knows, I'll probably end this and I'll realize that I missed something that I wanted to add. But yeah, that's where I'm at right now. It's either take this fucking poisonous medication that's going to fuck me up royally, or just continue to suffer with the condition because of health insurance, because they just don't want to pay. And that's what we pay them for, right? For them to just fuck us raw right in the asshole. You gotta love it. Gotta love health insurance. So yeah, that's my rant on my experience with the healthcare system lately and health insurance. And I don't foresee this getting better anytime soon. And yeah, I think that's all I got. So if you've listened up to this point for about 25 fucking minutes, I commend you and I thank you. I doubt anyone will really see this video. They'll probably get 1 or 2 views, whatever. But I just have to rant about what I've been going through and how absolutely ridiculous it is and dystopian it's been for me. But yeah, anyway, that's finally it for me. I appreciate you guys. Thank you.